this special interview, Why I Love My Dentist More Than My Valentine's Chocolates. I'm Tony and I work with dentists from all over the world who transform lives by making dentistry more accessible by reducing the 20 most common fears of the dentist. And today I've got a special interview for you, let me explain. During this interview, you'll uncover new secrets, methods, technology and new ideas to reduce or eliminate your fear of the dentist. Now that no one else is talking about in the dentistry world. So here is my guest today, it's Mark Skimming. How are you doing, Mark?
I'm good, Tony. How are you?
Yes, I'm absolutely fabulous, thank you, and thank you for asking.
Good.
So Mark, just tell us a little bit about yourself, please, first.
I am 32, just about to turn 33 next week, and I'm married to my high school sweetheart. We've been married for coming up 6 years tomorrow, and I've got 2 kids, Emily and Matthew, and one that's baking right now, one on the way during December, and we live back in my hometown, close to the babysitters, and I'm a dentist.
So tell us that you're quite an interesting dentist. Now I work with dentists all over the world that practice pain-free dentistry.
Yep.
But you're quite an unusual insofar as that you're young in terms of you won an award at the time. You were one of the youngest to win that award. Tell us what that was.
Yeah, so basically I finished my standard dental degree at Glasgow University, and I saw the advanced treatments that were going on around the world, not so much in Scotland, maybe down towards south of England and in London, but nothing was really happening up in Scotland. So what I decided to do was work part-time and go back to university and eventually complete a master's. And it's called a Masters in Restorative Dentistry, but at least a lot of it was kind of the advanced techniques to do a lot of these more advanced treatments. It just gave me the kind of comfort and confidence that I was able to carry them out. So a big part of my career is really, and still is keeping up with the cutting edge of dentistry, but really just feel comfortable with a good foundation of these advanced techniques.
Yeah. So you were also, a couple of years ago, you were invited to speak at a pain-free panel.
Yeah.
At a dental conference with a few hundred dentists there. Just tell us about that.
Well, I was invited to speak at this panel because there seemed to be a lack of understanding within the profession about us dentists, because there's not many of us that really focus on the pain-free treatment, where our focus isn't on the tooth, it's on the person attached to that tooth. Our fundamental basis of treatment isn't really to treat that tooth, is to treat the person and make sure that, we get the best result for them clinically, but we keep them as comfortable and pain-free during their treatment as it carried out. So what we kind of was invited to speak about was some of the myths and explain some of the frustrations and fears that people have about coming into dentistry and how we're able to address them. And certainly from the feedback that we get each time we speak about something like that, it really opens up dentist eyes, and also the people that come to see us really open up our eyes about the small steps that we make that really make a big difference.
Now, this interview is unscripted. I've got my own things I want to go through with you, and so coming up, I'm going to embarrass you.
Okay, thanks.
With a photograph. But why I'm also interviewing you as well is that this is going out to dentists all over the world, is this interview, but also I hope that you use it with your patients and patients. Mm-hmm. But you're the author of this new book that you've just brought out, which is Why I Now Love My Dentist More Than My Valentine's Chocolates. And it is the most comprehensive book I've seen on fear-free dentistry. I work with dentists all over the world, but I've never seen one do a 155-page book It's just incredible. Tell us why you decided to write a book.
Because after speaking at these pain-free panels, after speaking to a number of dentists that really don't understand what we do, I felt that there needs to be more explanation to be able to provide that, but also to provide some sort of confidence from our patients that we do know what we're doing, and that we can match our claims and explain exactly what it is that we do, and to show that we have an understanding, not just of the dentistry, but of the person that's having the dentistry carried out. So we use these books and we give them to people who inquire to the practice or attend the practice, and we've given out a number of them to some other dentists that work in other practices where they want to improve our understanding of the techniques and the treatments that we carry out. So,
tell us the moment that you decided to focus, on what was the moment when you decided to focus on pain-free, fear-free dentistry? Can you remember?
There's various kind of touch points throughout my career. Having had a fair amount of dental treatment, I had a tooth knocked out when I was in my late teens playing football. I have an implant. I didn't particularly enjoy the experience that I was given, although the treatment was excellent. But my thinking was, we need to make this experience better, make it more acceptable, because it's a fantastic treatment. So, that was one big kick. Various others were, I'm a bit of a geek, and I like technology, and I like to be at the cutting edge of things. So when the opportunity came to get some of these pain-free injection treatments, I was there to jump straight on board with them. And we spoke to our patients, and we asked them, did you feel any pain during your appointment at all? And we went through hundreds and hundreds of patients, and we still do. We still ask our patients, did you feel any discomfort? And it's coming back where they're telling us, no, I didn't feel any pain at all. So with these specific techniques that we use and the specific equipment, we are able to change that. But through my own experience of having dentistry carried out and the experience of the people who come and see me, we felt that providing it pain-free and focusing in on that was something that was very unique to our practice, and also doing some research on some dentists that were starting to try this type of treatment and make it pain-free 100 years ago, who weren't looked at so fondly within the profession. We're really kind of breaking new ground, and every time you do that, the profession tends not to like you so much. There's a guy called Painless Parker, who a long time ago was really kind of at the forefront of pain-free dentistry, and where we see as well is just really carrying on that groundwork from there.
So does pain-free dentistry really exist? That's what people are asking.
In a short word, yes, but it has to be done a certain way.
Yeah.
So it's not a case, and it's certainly not something that gets taught at dental school. You probably find that any dentist who is practicing pain-free treatment is someone who's very experienced, has bought into some technology and really makes that effort. And it's probably the effort more so than anything. I think one of the things in the UK that is a barrier to having pain-free treatment is possibly the way that some treatments, not all, but some treatments and in some practices, because of the limits of funding from the NHS, there are certain time limits. And so the time to be able to commit to those patients can't always result in a pain-free treatment. So I think that's one of the biggest barriers that we have in the UK.
Okay, well, I'm just going to put on some slides on the screen now, so just bear with me.
Yep.
So let's have a look here. We have got, okay, so this is a nice little, this is your logo,
yeah,
around this Valentine's chocolates, and why this person's got their arms in the air, and I like to call the anxious market the kiss and hug market, because you really do transform their lives. Why do they love you more than Valentine's chocolates?
Well, when we tend to meet somebody who is maybe just slightly anxious, or somebody who has a severe phobia about seeing a dentist, when we first meet them, it's often, you know, a kind of slightly stiff handshake. But for the vast majority of them, not all of them, but the vast majority of them, at the end of the treatment, it's hugs and kisses and big smiles. And so when we originally looked at releasing the first draft of the book, we were looking at doing it at kind of Valentine's stage. So, you know, hence I love my dentist more than my Valentine's chocolates.
And this is me on the left. This is, I'm a trustee of Dental Mavericks. This is me on the left with my wife, Callie, the backbone of Dental Mavericks, on the right-hand side. And here we are in Morocco with, we've been going to Morocco for 6 years, and we end the daily dental pain for Moroccan kids, and we've taken nearly 4,000 kids out of daily dental pain. And our philosophy in Morocco is pain-free dentistry. And you have a colleague, Amy.
Yep.
Just tell us about what Amy did with the Dental Mavericks.
Well, first of all, Dental Mavericks is a charity that's very close to our heart. I initially was supposed to be attending to treat these kids in Morocco. But due to my son being due around about the same time, I wasn't able to go. So gratefully, my therapist Amy had taken my place, and what she's been able to do, and it's been very rewarding for her. She gets very emotional every time she talks about it. But what they do is get these kids who stay high up in the mountains and have no access to any dental care, and due to, you know, changes over the last decades into their diet and a lot more sugar into their diet, they're having a lot of dental problems. And really, they're in daily pain for a lot of these kids. So what Dental Mavericks has been able to do is go in there and take these kids out of pain. We've been a financial contributor to it directly, and our team and myself in the future have been contributors to actually going out and carrying out the treatments there.
Fabulous. And this is an interesting one. Dental Phobia certified. Now, the way that, you know, how do you know? We have to ask ourselves, how do you know if your dentist can give you fear-free dentistry or pain-free dentistry? And the best way to ask your dentist is to say to your dentist, on a scale of 1 to 10, 1 being lowest and 10 being highest, how confident are you that you can deliver pain-free dentistry to me? Now, if I ask you that question, what's your number, Mark?
I'm 10.
10. So, as you can see, you've got to have your dentist has got to have the self-belief that they can do this. If they're below 8 or 9, then, you know, you're taking a risk. So tell us about, you're also certified with Dental Phobia, Mark.
Yeah. Dental Phobia has nothing to do with us directly. They are an independent organisation, excuse me, and you have to pass certain guidelines to be able for them to be able to certify you. They want to hear from the people who have had treatment carried out. They want to be able to know that we are following specific steps to be able to help people who specifically have phobias. And who have, you know, a specific fear about any, you know, a number of aspects of dentistry, which is very much explained in the book. Okay,
so again, coming back to the book, we'll quickly touch on one of the fears, but there's 20 fears of the dentist in here that answers all your questions in this particular book. So if you haven't got this book, you must request it off Mark's site that we'll give you in a minute. Now, this machine on the right-hand side is called a water lathe.
Yeah.
Tell us about this, and why do these machines cost £60,000?
Okay, so this picture just shows me this is me and my extreme geekiness, first of all. But yeah, very expensive bit of kit that we've had for a number of years now. We're one of the first practices in the UK to have it. One of the things about the laser, well, it has a number of factors. What we find is it reduces first of all, patients are numb, so they're not experiencing anything during the procedure. And what Waterlays does is improves recovery from any of the techniques and treatments that we're carrying out, as well as, especially when we go down the implant field, reduces any post-operative discomfort, and also it actually improves the binding of implants onto the bone when we're placing them.
So this is this machine it virtually can do virtually everything the drill did.
Yeah.
So one or two cases where you can't, but virtually drill free.
Yeah. So in a lot of these cases where you don't actually have to even have any anaesthetic to have a filling carried out. So yeah, it reduces sensitivity in areas. So and a huge number of available options to use it for. And whenever somebody comes in to see us and they tell us, I don't like the drill, I don't like the noise, I don't like the thought of it, I don't like any vibration, so we can carry out the work using the laser.
So just tell us something about the just let me stop sharing this. I want to see you again. So just tell us about your something called a quick sleeper.
Quick sleeper is a digital system for getting teeth and gums numb to carry out treatment. Now, specifically on this system, there is a feedback sensor, and really what it does is what we found in research, and this is research that I actually started when I was a dental student, but the research has shown that although the small nip from the injection can be uncomfortable, it's mainly the injection of the fluid going in, namely that it's going in too fast, or it's too cold, or it's too acidic, that results in the pain. So by making sure that our anaesthetic is warmed, by making sure that it is injected very, very slowly in a gentle fashion, and we can create a pain-free injection experience.
And this is, so do you also use numbing gel that most people don't?
Yeah, we don't do an injection without it. Numbing gel, we've got to dry the gum first of all, place the numbing gel. Generally it's bubble gum flavour. Some of the other ones can be quite bitter tasting, so we want to use a flavoured one as well. And we leave that on the tissue for normally a couple of minutes. So when an injection is carried out, you actually don't even feel the needle at all.
So what we're getting here is it's not just about the equipment that you use, the kit that you use, and also it's the techniques you use, but also more importantly, which we'll look at now, it's also the people that they meet. So before people come in, before people see you, they meet. We've just gone over there. Sorry, how to. That's one of the biggest dental fears is needles, and you use lots of techniques to overcome that. So that's not a problem. So before people even meet you, Mark, they meet a lady on the left here called Elaine, the far left. So just tell us where this is first of all. Before we meet Elaine.
So that's us at that's Elaine. The whole team were at the Dental Mavericks charity ball. It was a mods versus rockers. So all our team went as mods, and that's where we made some of our contributions towards the charity.
So this for the past, you've been coming to Dental Mavericks balls once a year, and you take your full team. You bid for prizes, you donate. And last year you gave £1,500 to Dental Mavericks.
Yeah.
So tell us what happens when they see Elaine on the left, because they see Elaine before they even see you. Yeah,
well, they see Elaine and also Zara as well. And really what that is, it's a free appointment where people are able to spend time with somebody who, unlike when they may attend somewhere else where the dentist doesn't have a lot of available time, they can actually come to somebody and tell them exactly what they want, exactly what they're looking for, the challenges they've had with any dental treatment before, And so rather than the 10, 15-minute typical dentist checkup appointment, we're again focusing away from just the teeth and the gums, and we're focusing on the person, so we can meet their specific requirements, because there tends to be a one-size-fits-all kind of dental procedures, the way that they're carried out. So really what we want to find out is go a bit deeper than that, and find out, okay, have you had any challenges by having dental treatment before, and see what ways we can modify treatment to meet those specific requirements.
So to Elaine and Zara, they go through the fears, frustrations, slowly.
Yeah.
Sometimes they can meet away from the practice, doesn't have to be in the practice.
Mm-hmm.
So a real nice way that you do your dentistry. Now, tell us about this pain-free, fear-free, non-judgmental. Why is that important to a nervous patient?
Well, pain-free for obvious reasons, and that's our primary focus when we're carrying out treatment for somebody. Fear-free is because we want to break down that barrier of when someone comes in and has their treatment, we understand that we don't just get that immediate trust from them. That takes time to establish, and by maintaining our promise of pain-free treatment, we are then able to establish a fear-free environment for them, where they're able to come in and they put that trust in us, and we maintain that trust for them, so they that phobia gradually disappears from them, and when we see them at the repeat reviews appointments, they're no longer coming in fearful of coming in just for even a checkup or their cleaning. The non-judgmental side is, we did some research and finding that, and understandably, life gets the better of us at times, and we don't always keep up with the appointments that we know are required. So if somebody hasn't been in to see us for 2 years, 3 years, or even somebody who's coming to us for the first time and who's very embarrassed about the way that they've maintained their smile, they're not going to be judged on that. That's not what we do. First of all, our job is to be there to help everybody, to get them to the position that they want to. We always say, well, there's no better time to start, or the biggest thing is for them to come in through the door, and we reward them for that. We tell them, well done, that's great. You've made the most difficult step. Now it's just to get you to the position where you can smile, you can socialise, you can eat the food that you want, and live your life. Dentists focus on the dentistry too much. People don't want to have dentistry done. People get dentistry because they want to lead the life that they want to live. So that's what we do, and it's not about fixing teeth. It's about providing the lifestyle and the comfort and the confidence that people can live the life that they want.
Now, through our own research of working with dentists around the world, one of the biggest challenges is, as you say, the fear of being judged. Yeah. So, these patients that haven't been in for 50, 30, 20, 10, it really doesn't matter. What matters is that you get your life back on track. Yeah. And there are lots of ways, whatever your fear is, it's not your fault. No. And it can be a parent, it can be all sorts of the dentist that you saw when you were a child that started this off. So, get in there to see, if you don't see Matt, just get in there to see somebody that can help you. Now, this is a picture, Mark, that I said I'm going to embarrass you with. So, tell us what this is as well, then.
That's us at the Dental Mavericks Ball, and that's our team of mods. And
so you can see all the team there. You guys like to have fun. You're so different than, a lot of dentists have a facade of being professional where you're just wanting to laugh and open and fun. And, we'll look at some of your promises in a minute, but one of your promises is that you are, fun people to be around. And it's so true. You can see that by this photograph here. So tell us about you promise 3 things and you measure that. So tell us about that.
Okay, so we call ourselves phone fanatics. And and we make sure calls are answered 24/7. We'll make sure that nobody will hit an engaged tone, and so all calls are answered either by us or the backup team, and we'll make sure that nobody will miss out and nobody feels that they're not receiving the standard of service that they want to receive. We make sure that we value everyone else's time as well as our own. So we don't keep you waiting. We make sure that the appointments are seen on time. And these are things that we measure every single month and is fed back to us. But our number one is pain-free dentistry. And I can't highlight that enough. The efforts that we make, the extra training that we have, the extra tech that we have, is that we're not focusing on, quick, get that job done. It's about creating a better experience and a better environment to have your dentistry carried out.
Tell us about this money-back guarantee. Why do you guarantee pain-free dentistry?
We're confident. We're confident in what we do. We're confident in the service that we provide. And we feel that, because of people's experience of dentistry in the past, that may look like a bold claim, so we need to be able to back that up.
And so tell us about this people, well, you've seen the third promise is the people-friendly promise.
Yeah, so, we, like it goes back to the same, our ethos is that we don't focus on the teeth, we focus on the person, and make sure that they get the best result that they can be carried out on their terms.
And let's have a look now, because this is stuff that your average dentist just doesn't do. And this is, every patient that comes in, you ask them the following questions. Tell us about this. Okay,
so we carry out a survey. It takes just a small bit of paper. It takes 5 seconds for somebody just to fill it out. And we measure ourselves against our benchmarks to see, are we living up to our promises? And also it provides us, if something isn't being done the way that it should be, then we can introduce a training need and quickly bring things up to scratch.
So 688 of your patients were surveyed and agreed that 94% said yes, they would recommend you. 98% said yes, they were seen on time. And 98% said yes, the treatment was pain-free. So I think that's quite phenomenal. Tell us about...
It's even improved since then, Tony. We measure it even further. And that was our kind of first block of measuring. We've been able to kind of measure a bit deeper and introduce new training to the practice, and those numbers have improved even further still.
Fabulous. So tell us about I'll just jump to this, so the pain-free environment then. Why is this, explain what's going on in here.
And we want to move away from a clinical environment, because when I walk into a standard dental practice, number one thing I notice is the smell. Number two, I notice is the 2 or 3 years old magazines that are all dog-eared and broken down. And just a generally uncomfortable place to be. So what we've tried to create is a home-like environment, and we've even refurbed since that picture there to make sure the place is as comfortable as possible. Treat it like your sitting room. There's nice teas, coffees, fresh water, Wi-Fi, and so if anybody does come in for the appointment early, then they have somewhere comfortable that they can sit and relax. If you come in for your appointment just before you're taken, you're really not hanging about for very long.
And that survey proves that 98% said they were seen on time. So that's really important for an anxious person.
Absolutely.
So tell us about these goggles then. What's this?
So these are video goggles. So of all the technology that we have in the practice, this is what impresses people the most. And there's a bit like, I always remember coming back from a plane after being in a course in America and sitting on a US Airways flight and no video, 10-hour flight back from Chicago, and when I rushed to the airport, didn't pick up anything to read, magazines, and I was bored out of my mind, and it's the longest 10 hours I think I've ever experienced. So looking back to that analogy, you know, people will feel that's the same when they're having their dental treatment done, you know, where 1 minute for them will feel like an hour. So if we can let that time pass quicker for them, then all the better. So when we're carrying out a lot of our treatments, certainly with all our implant treatments, people are regularly watching a DVD on our DVD goggles here. So I had somebody in last week who had 10 implants put in to replace all their missing teeth, and they said the time just went by quickly, and they watched an episode in Glasgow. There's a very well-known TV show called Still Game. It's very much of Glaswegian or even Scottish humour, and to have something like that carried out and have somebody laughing through it, I think we're really throwing the experience on its head from what people expect from dentistry or the standard of dental treatment from a patient's perspective.
Cool. So just let me show you this. Again, Mark don't know what's coming up. It's all unscripted. So our patients, or Mark's patients, say it best. So this is a testimonial. These guys are at the top of their game, over the moon with their work, and not one bit of pain.
I actually saw Dave. We fitted his implant crown a few months ago, and he's been back in for his checkup, and he was just telling me how delighted he was. And I said, "Well, why did you give us 4 stars instead of 5?" He told me it was a typo. He said he's going back in to change it for us.
So you've got more online reviews than any other dentist that I've seen because of your pain-free philosophy.
Yeah, I don't really know why that is. I don't have an understanding of, you know, because we do things slightly differently. People are keen to go and give us an online review, but we have a significant number of reviews across a significant number of sites, and I think that a lot of the time, the people who find us are currently very kind of tech savvy. So they find us through an online means that, you know, they've got to that desperate stage where they can't find anything else to help them, so they Google, and you know, people travel for a long distance to come and see us. So, you know, they're all very much engaged in our website, they're engaged in our social media sites. So when they finish their treatment, that they go in and they write a review for us, and you know, not requested for, but it's great, and we really appreciate everyone that does it.
Now, as also on your website, that will, this video is probably on your website anyway, but there's dozens and dozens of video testimonials and more testimonials. And just let me.
From start to finish, it's been completely relaxing. You come into the surgery at the start and it feels more like a home than an actual dentist, because everyone is so friendly, they can't do enough for you, and you're just put at ease the minute you walk in the door. So I've just loved it, and I've not felt like I've been going to a dentist the way traditionally I had with my previous dentists. It's almost a pleasure to come every time that I have to come. So it's been great. Absolutely no pain. I've just had my veneer fitted less than half an hour ago, and even the prep of the tooth, I didn't even need an injection. I mean, there was no pain for the aligner, for any of the work that they had to do. I can't believe I've had my teeth fixed and no one's ever put a needle in my mouth. There's just no pain or anything that I traditionally associated with dentistry. It's been great.
Absolutely excellent. And I can say that it has been pain-free. You know, occasionally, you know, some discomfort, tiny little bit of discomfort, but pain-free.
During your experience in getting your treatment done, did you feel any pain at all?
Well, surprisingly, no. The only thing that I felt was a little bit of discomfort, but pain, absolutely not. I never felt anything. I could not believe how pain-free it was.
Did you feel any pain throughout your treatment?
No, that's one thing. Don't be frightened. You don't feel anything. You feel pulling and tugging the same as you do anything else. You don't feel pain. Definitely not.
Okay. And are you quite nervous of the dentist? Or?
I was, yes, but I'm not anymore. Definitely not now. Mm-hmm.
And how would you say that your overall experience was at Dentistry on the Square?
if you had to put it in a 1 to 10 scale, it would be a 10, 11. It was outstanding from the moment I came in to the moment that and I'm still here, obviously, but yeah, the whole thing was just pleasurable, which is something I never thought I'd hear myself say from a dentist.
Thank you. Would you say that you felt any pain throughout your treatment? No,
I mean, apart from a slight discomfort every now and again, compared to other practices I've been to, it is what it says on the label. It is pain-free. It's the most pain-free experience I've ever had in the dentist in 55 years.
Wow, that's nice. How did you feel so you didn't know I was going to play those?
No, I didn't. Obviously, we have a lot of testimonials on our website, and we do ask for people to give us video testimonials, and we don't script anybody. These are their own words, and these aren't just my patients. You know, the way that we carry treatment out is it's a full team approach, so everybody's been involved. So, you know, when people say they're experiencing a wee bit of discomfort, it's things like you know, when we take impressions, you know, nobody likes having an impression taken, although we do have new techniques to try and avoid that now. But, you know, it's great, you know, people are telling us that they're not experiencing pain, and that is, you know, very much a goal of ours.
Now, just this is tell us. You are into various causes,
yeah,
and this is tell us what happens when somebody avoids going to the dentist. There's 2 diseases that it causes. So tell us about this one first.
Well, we're big. This is really a big campaign we got involved with throughout the UK for mouth cancer awareness and reducing the people who are dying of mouth cancer every day. Glasgow in particular has very high rates of mouth cancer due to rates of smoking and alcohol consumption. And we feel that, especially for people who are denture wearers and who have false teeth, and even those who are not attending their dentist regularly, that they're not being screened for mouth cancer. And I think that although dentists are doing it, it's not understood enough by the public. So every time we carry out an examination or a review or check-up for somebody, we give them a full mouth cancer screening to make sure there are no signs of mouth cancer. And we also, you know, address how many, the risks, shall we say, typically through whether they're smokers, how much alcohol they consume, and just trying to educate a bit more, because we actually see and have a lot of patients who have been treated with mouth cancer, and it's fantastic. It's the job as the surgeons have made. These people are often not the same again and can't live the same lifestyles and have difficulties. So if we can, the biggest thing to treat and address these issues is to catch these issues at a very early stage. So the biggest factor is for them to attend a dentist, and we really wanted to raise awareness for that. And you know, John Lennon's Tooth visited us as part of a campaign and a fundraising event to reduce those dying of mouth cancer.
So it's not about, yes, it's important, it's about being able to eat the food that we want, because we might have left it a while. It's about, you know, getting new relationships because we've left it a while. It's potentially could be about getting a job promotion because we've left it a while. But yes, all those things are very important for us as human beings. But also, more importantly, is that if you don't go to the dentist, you don't know whether you've got mouth cancer.
Yeah, I mean, screenings are becoming far more important in a number of areas, particularly for females. But, you know, mouth cancer, the best way to have a mouth cancer screening is visit your dentist. It should be getting done. And ask your dentist about it. A lot of dentists, because don't really like to talk about these things to patients, but you know, understand that they are checking you for this, and but they're probably not making you aware of it, because when you start to talk about it, patients can worry a wee bit. Why are you checking me? Am I at risk? Whereas we're quite upfront about it. We tell them it's a standard practice, and try and raise that awareness and make sure they are coming in regularly to have these checks carried out.
So if you haven't been to the dentist for years, number one, you need to go to get mouth cancer checked.
Yeah.
And the second big disease is something called gum disease.
Yeah.
Tell us about gum disease. Now, apparently, they say that it's about 70% of the population have got some form of gum disease. What happens with gum disease, Mark?
Well, gum disease has a number of factors, and it's linked to a number of diseases. Gum disease is essentially a disease where the inflammation around the teeth and the gums causes the bone around the gums to shrink away. So there's no longer anything holding the teeth in. It's a bit like some land slipping around your house, and the foundations of your house are no longer surrounded by soil or cement. So the house starts to drift. Eventually the house starts to tip on one side, starts to move, and eventually it's got to come down. So like a house, if these things of periodontal disease, of gum disease, can be addressed in early stages, then we can stabilise things. And it's a bit like diabetes. We can't ever say you are cured, but what we can do, like diabetes, is stabilise it, control it, and make sure it's not becoming an effect on somebody's life. And these treatments have to be very bespoke for the individual, depending on their reaction to the treatment they carried out. But there's, as we progress, and every year it's coming out now that gum disease is affecting something more. It's been highlighted very much so, and a big problem in Scotland is the link between gum disease and heart disease. Very high rates of heart disease in Scotland. So access to dental care and attending your dental care, doesn't just affect your teeth; it affects your full general health. But it's shown to affect your brain, your lungs, pancreas, kidneys, and pregnancy as well. There has been a very, very strong link between low birth weight babies and the risks associated with having low birth weight babies and gum disease.
So this cardiovascular, so a lot of people, some people don't realise that the mouth is a gateway to the body. So everything that happens in the mouth is linked through the blood, through bacteria goes in there, it goes all over the body. And research that I've seen, that if you've got bad gum disease and you haven't been to the dentist, then you can be at risk, 28% are at risk from cardiovascular disease, heart disease. Also the brain, so there's also research that stroke, again, so the bacteria gets into the brain, it gets into our body and causes lots of problems. So again, please go see your dentist, because you're potentially at risk from mouth cancer and potentially at risk from gum disease as well. So just let me... So in sum then, imagine... I'll just stop that there. So imagine guilt-free, stress-free, pain-free, anxiety-free, non-judgmental free dentistry. How will this transform your life? Your self-confidence, your career, your relationships. What do you say to that, Mark?
Yeah, I mean, that's really what the book focuses on. And really showing the difference that a dental team and our dental team make on a daily basis. We had this conversation with the team at our quarterly meeting yesterday, and every single one of us had a story about how we impacted somebody's life for the better, and so it wasn't about their teeth. One of the stories we had recently was how we had a husband and wife, or a husband and wife to be, come in, and they completed their treatment, and she came in after our wedding to thank us so much, because all the guests kept on saying how much it was the first time that they'd seen her husband smile and how much that meant to her. She got very upset when she said it, and everybody was getting a hug and a kiss and a thank you, and there's no more rewarding thing for us and for our team and the culture within the practice to see that that's something we can do. And when we have that, we want to do that again. We want more of that. But, we love it. It's great.
Now, also, we'll just finish off, but inside this book at the end, there's loads of advice. So if you've got a family friend or anything, just, order 2 books, doesn't matter, they're free. Go to dentistryonsquare.co.uk, get 2 books, give one to your family or friend. Whatever challenge they've got, it is answered in here, and how to overcome that fear. But also, and more importantly, at the end of the book, there's a section called Rate Your Dental Fear, and you can put down what your fears are, and what it does is it will give you a score of, where you're at with this particular fear and what you need to do about it. So an amazing book. Grab the book online. And this, I stole this quote from you, Mark, and I'm just going to read it out. And it says that in the future, this is how anxious, nervous, or fearful people of Scotland will enjoy their life more. Make their smile straighter, whiter, eat the foods they want, go out socially again, find a new partner, and end their fear of the dentist. Only you don't have to wait, you can start right now. And I thought that's a fabulous quote, and there's lots of other quotes that you put in your book as well. So we'll just leave this. I'll just share my screen for the last time, and which is this here. So, Mark, what would you say in summary to 25% of the population that have got some form of fear of the dentist? What would you say to that person?
Please don't despair. No matter what difficulty or what challenges you've had at a dentist before, there are solutions, there are treatments, there are methods that you can have your treatment carried out. You need to find the right person, someone you're comfortable with, someone you have confidence with, whether you want to have it done quickly or slowly, take your time, whether you just want to talk it over before anything is done. That's what we're there for. So, we are available. We have, give us a call. If you're not ready to even take that plunge yet, request a book, have a read of the book. It will open up your eyes to our insight of what we can do and how we can help.
Great, well, thank you, Mark. This interview. You're the first dentist I've interviewed hundreds and hundreds and mentored hundreds of dentists from all over the world on pain-free. Never come across one with such an extensive book. So thank you for allowing me to interview you. This will be going to dentists all over the world to encourage them as well to make pain-free dentistry accessible to 25% at least of the population. So thank you for joining us, Mark.
Cheers, thank you, Tony.
Thank you.
Thank you, bye.
Bye.